So, what if a common protein, one that's in your daily bread, could actually turn your own body against itself? Today, we're going to unpack that exact puzzle as we dive straight into the world of celiac disease.
It sounds a little like science fiction, doesn't it? But for people with celiac disease, that is the startling reality. Your body's own defense system literally wages the war against its own tissues. And it's all triggered by a simple protein found in things like wheat, barley, and rye. This is the core conflict of celiac disease, and that's exactly what we're here to understand.
All right, so here's our roadmap for today. We're going to start with why this is such a puzzling disease. Then, we'll get into the all-important gluten connection. After that, we'll walk through how it's diagnosed, how it's managed, and then we'll take a peek at what the future might hold, before we wrap up with a quick quiz to test your knowledge.
So first up, the mystery. You know, celiac disease is often called a clinical chameleon, and for a very good reason. It just presents so differently from one person to the next. And this sheer variety is a huge reason why sometimes it can take years to get a proper diagnosis.
And here is where that puzzle gets really tricky. Most people hear celiac and immediately think of gut problems, diarrhea, bloating, nausea. And they're not wrong. That's definitely a big part of it. But the real clues, the ones that often get missed, are found completely outside the digestive system. We're talking about things like iron deficiency anemia, just bone-deep fatigue, a very specific and itchy rash, even headaches and joint pain. These are the symptoms that can fly under the radar and make this case so hard to crack.
So what in the world is causing all this chaos? Well, let's play detective for a minute. We're going to investigate the culprit, which is gluten, and the scene of the crime, the small intestine.
Okay, this definition right here is our foundation. And honestly, every single word counts. It's autoimmune, meaning your body is attacking itself. It's genetically predisposed, so not everyone is at risk. You have to have the right genes. The trigger is ingesting gluten, and the site of all the damage is the small intestine. So how does this attack actually unfold? Well, it's this remarkable cascade of mistaken identity. First, gluten gets into the small intestine. Then, a totally normal enzyme in your body called TTG actually modifies the gluten a little bit. For most people, this is no big deal. But for someone with celiac, the immune system sees this modified gluten and completely freaks out, flagging it as a dangerous invader. And in that final step, the body launches an all-out assault, causing a ton of friendly fire that just destroys the delicate lining of the intestine.
I love this analogy. Think of a healthy intestine like a lush shag carpet. It has all these long, finger-like things called villi that create a massive surface area for absorbing nutrients from your food. But in celiac disease, that constant immune attack just wears that carpet right down to a flat, hardwood floor. The villi get blunted and flattened, the surface area shrinks dramatically, and your body just can't absorb the nutrients it needs anymore. This is what we call malabsorption, and it's what drives so many of the symptoms we saw a minute ago.
So who needs to be most aware of this condition? Well, genetics is a huge factor. If you have a first-degree relative, a parent, a sibling, a child with celiac, your risk is much, much higher. It also tends to show up alongside other autoimmune diseases, like type 1 diabetes and autoimmune thyroid disease. And it's also more common in people with certain genetic syndromes.
Okay, so now we know who's at risk, and we know what's happening inside the body. So how do doctors actually solve the case? Well, this is the clinical investigation, and it all starts with some very specific blood work. The investigation almost always kicks off by looking for the weapons of that misguided immune attack, the antibodies. And the single best screening test we have looks for the tissue transglutaminase antibody, or TTG-IgA. Remember TTG? That's the enzyme that messes with the gluten. Well, the body makes antibodies against it, and this test is just fantastic at finding them. Now listen up, because this is a fascinating and super important clinical pearl. That TTG-IgA test is looking for a type of antibody called IgA. But get this, a small percentage of people are simply IgA deficient. Their bodies just don't make very much of it. So what happens? Their screening test comes back negative, but it's a false negative. To get around this, it is absolutely critical to also check the person's total IgA level, just to make sure the test results are even reliable. Now, while those blood tests are really powerful clues, the definitive, gold standard for diagnosis is an upper endoscopy. This is a procedure where a doctor can use a camera to look directly at the small intestine and take a tiny tissue sample, a biopsy. And when they look at that sample under a microscope and see that hardwood floor, that villus atrophy we talked about, that is the final, undeniable confirmation. So, with a diagnosis confirmed, the whole focus shifts. It's no longer about investigation. It's all about management. And this is not a temporary fix. This is a dedicated plan for life.
So, what's the treatment? Well, it's pretty straightforward. The only effective treatment for celiac disease today is a strict, lifelong, 100% gluten-free diet. That's it. There are no approved medications right now. The treatment is simply to remove the trigger entirely and permanently.
And why is that lifelong commitment so vital? Because if celiac goes untreated, it can lead to some really serious long-term complications. That malabsorption can cause osteoporosis from not getting enough calcium and vitamin D. It causes anemia from a lack of iron. It can even impact fertility. And that chronic unresolved inflammation can significantly increase the risk for certain types of cancer down the line.
So, we've covered the problem and we've covered the current solution, which is all about diet. But what does the future hold for people living with celiac? Let's take a look at the road ahead.
Think of this table as your ultimate cheat sheet. If you only remember 4 things from today, make it these. Pathophysiology, it's an autoimmune attack on the gut triggered by gluten. Diagnosis, you start with blood tests, then confirm with a biopsy. Management, a strict gluten-free diet for life. And counseling, it's all about helping patients navigate that diet, avoid cross-contamination, and get the right nutrition.
But is diet the only hope? Absolutely not. The research on the horizon is incredibly promising. Scientists are working on everything from enzyme supplements that could break down gluten before it causes harm, to drugs that could modulate the immune system, and even a potential vaccine that could one day prevent this whole process entirely.
Okay, we have covered a huge amount of ground today. So to make sure the most critical points really stick, let's lock them in with a quick-fire round of questions. You ready? First question. When a doctor suspects celiac, what is that single best blood test they use to screen for it? You got it. That's the TTG-IgA test.
Question 2. The blood tests are looking positive. To be 100% certain, what's that definitive gold standard procedure for diagnosis? Yes, it's the small intestine biopsy.
And our final question. What is the cornerstone, the only effective treatment we have available today for managing celiac disease? You got it? A strict, lifelong, gluten-free diet.
And that leaves us with one final thought. At its heart, this disease is really an error, a mistake by the immune system. So as we get better and better at understanding immunology, you have to wonder, could we one day move beyond just avoiding the trigger? Is it possible we could actually retrain the immune system to recognize gluten as harmless, making this incredibly demanding diet a thing of the past? It's a powerful question, and it's one that scientists are working tirelessly to answer. Thanks for joining me on this explainer.